was his ACTH. We did do the genetic testing, but in South Africa, the genetic testing takes quite long. I think it took us about between 6 to 8 weeks to get the information back. So by then we knew the diagnosis. It was merely just a confirmation. In Ayub's case, he had his MRI as well, and he had no neurological damage. So with him, his adrenal glands does take strain in producing cortisol. So he is taking Covacort, and we just do his 6 months, 5 months MRIs to monitor. In his case, that's where we are. And with Ayub, we did do the tissue testing. He has 6 potential matches in Germany. If we ever, need it, inshallah, there's some hope in his case. With the swab drives we were doing, unfortunately, there wasn't any local donors that matched Ayub. But we've matched, there are 4 people that signed up at our swab drives that were matched people that were on the waiting list in South Africa. So that is like such a blessing, such a success story. That is, that's really great. So the swab drives,
other people. You helped save other people's lives.
I think that, any ALD patient or ALD family, you are handpicked for this journey, and it's not an easy journey, but we also have it with a purpose. And I definitely felt in our way we were there to answer others' prayers through the swab drive, through getting their matches. So that, also is something that I just kind of took comfort to. It's a funny thing when you're facing such a big difficulty in your life, you really need to take joy in the small moments. And that was one of my biggest joy factors, the fact that I knew we did the swab drives and we were able to save other lives. I think it's just a blessing.
You're saying the same words that I'm saying. I'm also always saying that this is there is a purpose for what we have, and for myself, I'm not sure. I think because I'm researching at both diseases, either adrenal insufficiency and ALD, and I'm trying to spread the awareness, or raise the awareness, and save other lives by the knowledge. So hopefully this will be the purpose, And as you said, we are handpicked. It's very rare, but alhamdulillah, hopefully we are switching this to something positive.
Yes. And I don't know how, in some other countries they have the ALD centers. In South Africa, we don't have any ALD experts. So, for example, in the city I'm staying in, we only have 4 pediatric neurologists. So it's not it's not easily that you get the right specialist to treat you.
Exactly.
And I really just want to...
Were they aware, or any of them were aware about the disease or not, about ALD, of the pediatric neurologist?
So they have leukodystrophy cases, but not adrenoleukodystrophy cases. If I'm not mistaken, our treating doctor said that it wasn't her own patient, but when she was training as a doctor, she had a colleague that had an ALD patient. So that was the only reference that she had. I do know that they consult some of the US doctors. They send through the MRIs, they get some information from them and advice on treatment plans.
Yeah, this is good. Okay, going to our other question, state the challenges that you faced during this journey.
I think the challenges for me was more just trying to care for my son. And it's typically you go to the doctor, they tell you you have this, you need to take this medication, do bed rest, do whatever. And as a parent, you can go home knowing these are what you need to do. And with this disease, you don't get a little guidance, you don't get anything. So I think the journey is very unique for everyone. The challenges changes over time. Like I told you before with how my son was, the biggest challenge was just keeping him safe. Physically keeping him safe was the biggest challenge initially. And now it's completely flipped. He's bedridden. He can no longer pose a danger to himself. So now it's just about giving him the right palliative care that he needs. But I think so overall, I think the biggest challenge is just the lack of information that there is about the disease. There isn't any adrenoleukodystrophy organization or support group in South Africa. The level of expertise in the medical field in South Africa, again, so even if it comes to South African research, there's very minimal research. So it was from a medical perspective, that was probably the biggest challenge. There was a time Abu Talib was sick and I took him to hospital, and they actually didn't treat him yet because the disease is so unknown. So they were calling various doctors to find out, is this okay to give him? How will it conflict with that? How will it conflict with this? So I think that's the worst thing. The worst thing is not having enough information and research from a medical perspective to support your journey. And and like I said, just the sort of the family support locally. The international ALD community has been amazing. There's lots of moms I've connected with, we shared each other's journeys, shared tips, and just sharing stories that kind of, I think initially in the early stages, when you see moms in an advanced stage and how they're coping and how they are navigating it, it's quite inspiring. I mean, in the beginning, we didn't leave the house, we were just homebound, and over time you kind of build confidence and try to lead his normal life and still give him experiences while he's here.
Yeah. And I'm usually asking also, in order to know worldwide, is there any support from your government, financial support or something like this, or no? Because I shared some of the stories. So some of the countries, offer this support and some not. So I'm just wondering, in order also to raise the awareness for something like this for the governments worldwide, that we are there. So.
Yes, I think I recently read a research article that said that while rare diseases are rare, if you actually add up in totality the number of people facing rare diseases, it's equivalent to the third largest country in the world. So we are definitely there. We exist. No, unfortunately, I don't know of any support from our government for this disease. There is a palliative pediatric organization that offers some support. So they kind of